I'm Dr. Anna Saylor, and I want to welcome you to Every Chiropractic Center. Every Chiropractic Center was established in 1998. The name Every Chiropractic Center comes from actually my grandmother's maiden name, and it was a way to honor her. I practice a very different technique. It's called KST, or Corn Specific Technique. It's a very, very gentle technique. It's a different way of looking at the body, too. There's about 250 different chiropractic techniques, and KST is one of them. We find that KST is the most effective. I use an arthrostem, which is a handheld tool that actually gently taps the bone into the right position. It taps at a very specific hertz, so it's under the pain threshold and at the healing rate. It's a very, very specific technique, but very, very gentle and very effective.
When you go to traditional chiropractic, you're used to the crack and the snap and the crackle, and you come out, and it's kind of like you think no pain, no gain, because it kind of hurts to go to the regular chiropractor sometimes. But you come in here and it doesn't hurt at all.
An adjustment shouldn't hurt. Actually, it's very gentle, and most people feel very relaxed as they get adjusted. It's so gentle that actually newborn babies will sleep through the very first adjustment. We use the KST and we use arthrostem on everyone. So down to my youngest patient, it was 2 minutes old. My oldest patient is over 100. So we can do a wide range of people, wide range of different ailments. It makes a huge difference in your overall health. With the arthrostem, we can actually gently adjust your cranial bones, which traditionally chiropractic cannot actually address. So we can see a lot of different things. We can adjust in a lot of different areas. We do a lot of things like sternal work and ribs, and it makes a huge difference in your overall health. With KST, we'll very rarely lay you down on the table because you don't get hurt laying down on a table. So we actually adjust you in a standing position, occasionally in a seated position, but also if you were to tell me like it hurts when I raise my arm, I can actually adjust you while you're raising your arm or in that position, so the position that causes pain, we can adjust you and the pain will go away that much faster. Imagine that you were in a car accident. Which kind of position were you actually injured in? You were injured in a seated position. So we'll actually adjust you in that seated position, maybe possibly with your hands on the wheel. That way we can actually very effectively get to exactly what caused the problem, reduce your pain right away, and make sure that you feel great. Our motto is, we don't guess, we test. So we are going to do the highest level exam possible. It is a very unique exam looking at a portion of your health and well-being that has likely never been checked before, the nervous system and the spine. We are searching to find the root causes of the issues and let you know if and how chiropractic can help you or your child. The first test we do is a physical examination by the doctor. Next, we're going to do a computerized postural analysis that will show us exactly how your spine is being affected by your posture. We're going to perform tests using our state-of-the-art Insight subluxation station. The Insight measures the autonomic and motor nervous systems through a series of painless, non-invasive tests with no radiation. This is the single most important series of tests we'll do in this office, as the information helps us precisely and accurately identify abnormal activity surrounding your spine. The first test in the series is the heart rate variability. This test illustrates your nervous system's ability to adapt to your environment. It shows us the state of your nervous system at rest. It collects data on the beat-to-beat variability of your heart. It gives us a snapshot of how you're dealing with stress in your environment. We're also going to do the rolling thermal, which has 2 infrared eyes and measures the difference in temperature on each side of your spine. Your skin temperature is controlled by the autonomic system, which regulates the various functions of your body that you don't have to think about: your heart rate, your breathing, organ function, skin temperature, and much more. We're also going to perform a test called a surface EMG, or a static EMG. The scanners measure small amounts of electrical activity. The more your muscles contract, the more electrical activity they generate. These scanners measure in microvolts, or 1/1,000,000th of a volt. We are able to accurately measure the amount of muscle spasms by measuring the amount of electricity generated by your muscles. We can then compare your muscle activity to normal muscle activity. All of these tests work together and will show us exactly where your nervous system is interfered with, and if it is, to what degree. And when we're done, we will sit down with you and go over exactly what the testing has found and let you know our recommendations. All of our tests answer the one question that you have had and the one that no one has been able to answer. Why do I, or why does my child have this problem? There's 3 T's that cause problems with your body, and the first T is trauma. Most people remember the big traumas, the slips and falls, the car accidents, something that actually gets them into the pain threshold, but also the daily traumas you do that you don't really even think about. You're sitting at a computer for 8 hours a day, or you're doing something repetitive, you're doing it over and over again. Sports injuries, those little things that make a big difference. You slip, but you don't really fall. So trauma is the biggest one. Second T is thoughts, and by thoughts we mean stress. Anything that's an emotional or physical stress can add, basically, I always say it's like a bucket, and every day you put a drop of water in your bucket. When do you notice it's filled? Or when do you notice that, when it's at the very, very top, One more thing is going to send it over, and that's what brings most people into the office, is their bucket is filled. And then the third T is toxins. And by toxins, I mean not only what you put in your body, but what you don't. So if you're not drinking enough water, you're not taking your vitamins, you're not eating well, that actually fills your bucket up too. My job as a chiropractor is to empty your bucket, get you down here so you feel good all the time. Think about chiropractic and dentistry. You don't brush your teeth once or twice and think that they're going to stay clean for the rest of your life. You actually have to go in for periodic checkups and make sure that your teeth are staying healthy. Same thing with chiropractic.
And I think it was the third day after she was born. I had myself adjusted after giving birth. I had my newborn Jean adjusted at the time as well. And I've been coming ever since.
You can't just get adjusted once or twice and expect that those 3 T's that cause problems in the first place are gone, and they're never going to reoccur. A lot of people come in not just for pain, but we actually see a lot of people come in for their overall health. We see them come in for things like depression, anxiety, stress. Stress plays a huge havoc in their bodies. So we actually adjust for a lot of different things.
I had depression most of my adult life, and I've been off depression medication for 2 years now.
With KST, we can get results very, very quickly. They tend to hold better, so your adjustment actually holds better. At the very beginning, we do see you close together, but it makes a huge difference really quickly. And you should see results within the first 2 weeks of care.
Through the stroking and the movements she makes, she somehow finds the problem and detects it and then treats it.
Your body lets me know exactly where to go. It's like a combination lock. You can have all the right numbers, but if you don't do it in the right order, you're never unlocking the lock. So what we might do is actually adjust the very top of your head and then maybe your little toe. If your body tells me to go there, that's exactly what order we're going in. As an adult, we see a lot of injuries that actually stem from a childhood injury. So if you don't take care of it, it becomes a bigger problem as you grow. So the sooner you can get your children in to get them taken care of, the faster they can heal. Think of the first 2 weeks of your care as a roller coaster ride. Sometimes you're gonna be better, sometimes you're gonna be worse, but our goal is to get you taken care of as fast as possible. I love helping people and making people feel great.